On board with us this morning, our good friend, Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. Dr. Joe, good morning. What do you have for us today?
Hey, Ray. I'm always trying to come up with stuff we haven't talked about, and seeing in the sports world, we talk on this show, and we have through the years, about dislocated joints that happen frequently in sports, shoulder dislocations, kneecap or patellar dislocations, even full knee dislocations with those wipeout injuries like the Nick Chubb injury. But I don't recall when we spoke about a fairly not uncommon injury is an elbow dislocation. And I've seen certainly in a career as long as mine several elbow dislocations. Many times I see them after the fact when they've been worked up, but I've seen them on the field as well. It brought to mind the classic was the Jaden Daniels injury a couple weeks ago, and that's what made me think of this. Is Jaden Daniels, a year ago, burst on the scene. He's going to be with the next great quarterback. And then in the way sports goes, this year he's having just injury after injury and can't shake the injury bug. So let's talk a little bit about dislocated elbow. It has a few unique issues to it. It can be a partial dislocation where it pops partway out, or fully out all the way, but you can see that there's something abnormal about the appearance when you get to the athlete and they're dislocated. And they're also in tremendous amount of pain. You could see how much pain Jaden Daniels was in. That's pretty typical. Really, really a lot of pain when that elbow is out. But really, until they get evaluated, the three levels of type of dislocation are simple, and that's by far and away the most common in sports, thankfully. That's where there's no structural damage to the elbow, but it takes some working up to know that. Secondly is complex. Complex where there's a fracture. There was some rumors going around with Jaden Daniels. There was a fracture, but I read in other places in the articles I read he did not have a fracture. His appears to be simple, and he's working towards playing again. Bad ligament tear or a fracture, that's a complex. Severe is a third level where they could have damage to the blood vessels and nerves that run through the elbow. Thankfully, in my career, I've not seen a severe elbow injury. That's one that needs emergent surgery. And so, from the standpoint of the treatment, the complex ones, in order to get that elbow back to its normal positioning, we may need surgery for the complex, the structural injury. And again, for the severe ones, that needs emergent surgery. But in the simple ones, most of the time it doesn't need surgery. And the real key first step is, of course, I need to talk about, when you see these, reduction is important, and that means getting the joint back in place. And it feels like everybody wants to give it a try to do it, but it's really one that it should be trained medical people. And so it is one that most of all the articles and everything say it should be done emergently. These people, our athletic trainers know, should be seen down in the emergency room and reduced, and sometimes given medicine for pain before that. And then they do the evaluation to see what kind of dislocation it is. The mechanism is that impact fall on the elbow. The sports, of course, we see a lot in football. But, Ray, I'm going to challenge you again today. There's a winter sport that's just gearing up right now, and it's a winter sport that by percentage of kids who do play it and have dislocated elbows, the elbow injuries are real common in this sport. Do you know which sport I'm talking about? In the winter?
Yeah, I'll say wrestling.
You are always right. Wrestlers have a really high incidence, and I've seen a lot in my career in wrestlers who land on that elbow quite frequently. They say you see it in snow sports and skiing. I don't see them as a sport, in my office as a team, so I see them generally on their own maybe weeks later. But one that's not in the books, but I've seen it in my career of all these 30, 40 years, is gymnastics. I've seen a lot of gymnasts with dislocations. The one thing about it is you start out, most of the time you can just evaluate it with a plain x-ray, but if there's questions, you may need to do a CAT scan to see the bony detail more. But again, the big deal with treatment is splinting. Splinting's really important in the first few weeks. And there's two types of splinting even. Static, we love these fancy words. Static means it's just you put them in a stiff splint, and then when they're starting to get better, you start them moving again. But in sports and athletes that really want to get moving, and you'll see this a lot on TVs on Saturday and Sunday, is there's these splints that have hinges on them, which you can dial in a certain amount of motion. And at the beginning, you keep it pretty stiff, and then you can dial in the range of motion as they're getting better and as they're rehabbing. And so that's called a dynamic splint. And most of our athletes and people you'll see out on the field, they will actually wear that splint for a while when they return to play, because we definitely don't want recurrences of this problem. This joint, for whatever reason, number one take-home point of the day, gets stiff and loss of range of motion more than any other joint in the body. It's just very common. So you don't want to throw a kid in a splint, a stiff splint, and then say, hey, we'll see you in 3 months or something like that. Many of these kids will get stiff or lose range of motion, some of them for the rest of their life in the elbow. And we've all, I think, seen people who have decreased range of motion in their elbow. We don't want that. That's a bad outcome. So we want to see them, we want to progress them, we want to get them going with somebody to teach them the range of motion and the strengthening, and typically 3 weeks in the splint, 3 or 4 weeks of rehab to get it stronger again. And these kids at 6 or 8 weeks is generally with a simple dislocation where they get back playing again. However, the biggest complication of stiffness and loss of range of motion occurs if they get recurrences. So we don't want to take a lot of chances with this. With getting them back too soon in a week or 2 or 3, because they could end up with permanent loss of range of motion. So the key take-home point, wow, this is something that the wrestlers get involved in. That's a really high percentage in that sport, but football players and others as well, gymnasts. Number 2 is making sure that you do splinting right. Splinting is really important. And number 3 is not getting people out there too soon. We don't want these permanent loss of range of motion injuries with dislocated elbows. But it's one that I don't know that we've covered ever or in a long while. And I wanted to just touch on it today because it is one that I've seen a fair bit in my career.
Joe, a lot of times when we talk about dislocations in different parts of the body, we'll talk about reoccurrence. And because you get one, are you more susceptible to it happening again? Same thing with the elbow or not?
Yes, Ray, that's a great point, as you always make. Yes, they are at increased risk, especially early on before they get their strength back. But it really does surprise me in a career of seeing these things, 40 years, how well most of them do when they're given enough time to allow the body to heal and then get somebody who knows how to strengthen them appropriately. And that's why it kind of matters for athletes. A lot of people get these not in an athletic situation, and they may not need as much detail with getting the strength back. But when they get their strength back, they do pretty good. It's generally kids who are sneaking out of the brace too soon or who did not really put in the time to get the strength back where we worry about the recurrences.
Gotcha. Joe, great stuff this morning. You're right. I don't know if we've ever talked about an elbow dislocation. So good education for us this morning, my friend. Well done. We'll do it again next week.
Thanks, Ray. Have a good week.
You too, Joe. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, taking time to join us again this morning.